It's a proud moment for me to talk on this year's World Heart Day because our association has gone a long way in the last 50 years in educating about heart disease, the treatment in our country, which has developed beyond my imagination. Because when I joined cardiac surgery, it was primitive. Now our specialty has reached almost all the corners of India, and every Indian is able to get the best treatment from the finest cardiac surgeons in this country. And as a past president of the association, I can proudly say that we have enough trained people to give care in all the forms of heart disease in our country. I wish everybody all the best, and please take care of your heart. Look after yourself. Take care.
On the occasion of World Heart Day, I bring you greetings from the Indian Association of Cardiovascular and Thoracic Surgery. A new initiative has been launched by the association called the Outreach Program, where our aim is to try and connect with the general population at large through social media. Connect with us on Facebook, Twitter, LinkedIn, Instagram, to learn from us the latest in the diagnosis, management, treatment, and prevention of heart disease. As you are aware, heart disease can occur from the newborn age to the adulthood. Especially in the younger population, congenital heart disease is a major problem that affects 1 out of every 100 children born in this country. Congenital heart disease is otherwise serious, but if diagnosed in time and treated surgically, many of these can have very productive and useful lives ahead. My message to you is that if your child has symptoms of blueness, failure to gain weight, recurrent pneumonia, or if your doctor, while examining your child, finds a murmur in the heart, then you should get it investigated by a pediatric cardiologist. And usually, most of these conditions can today be treated very effectively and with extremely good outcomes through surgery or intervention. Once again, on World Heart Day, I wish everybody a healthy life, a healthy heart, but at the same time, please do get your heart checked periodically so that you remain free of disease, or if you do have it, then you can get it treated in time and effectively. Thank you.
Yeah, I'm Dr. Bhattacharya, one of the cardiac surgeons practicing in Bombay hospitals. I had been the president of this Indian Association of Cardiac Surgeons, and it was a great privilege that I could reach this position. Today, if we have to give any message to the patient, we would like to say that no one becomes immortal by bypass surgery. We only are creating a better we are adding a longevity to the patient, and we are also providing him in a better quality of life. My general advice to the people would be that don't choose the extreme of diets. You should also see to it that you don't put on a lot of fat in your belly. Obesity should be avoided at all cost. If you are diabetic, you must control your diabetes. Keep it a very serious affair, because it is not that only heart will be affected by diabetes, but many other organs like eyes, brain, kidneys, anything can be affected by diabetes. So please see that the diabetes is a big killer, and you must see that in case if you become diabetic, please control it. Please very, very nicely control it and keep your HbA1c around 6 or low. I feel that exercise, diabetes, blood pressure, and of course, if you have a hereditary factor, please go and check up into your triglycerides and cholesterol. And there are very good medicines. If you can't tolerate something, there is some another drug, there is some another drug. Please bring down your LDL cholesterol as much as possible, preferably below 70. This would be my strong message to the general public. Thank you.
Greetings from the Indian Association of Heart Surgeons. World Heart Day on 29th of September is meant to spread awareness that heart attacks and deaths by heart attacks have truly risen in India to an epidemic proportion, when in the Western world they are going down. They are more in South than in the North, and this metabolic syndrome has many causes, but the important message is, to a large extent it is preventable by simple precautions of eating right, working out, not smoking, controlling obesity, and watching out if you are developing any diseases like diabetes, hypertension, etc., which are very easily controllable. Indian Association of Heart Surgeons is trying its best to spread this word.
This day reminds us that we must keep our heart healthy. In India, we are seeing the tsunami of heart disease and diabetes. We all know that there are various risk factors for heart disease, which includes genetic, diabetes, hypertension, obesity, and lifestyle derangement. For society, we are seeing that there are a lot many people who practice unhealthy lifestyle. Hence, this day we can take a pledge to lead a very healthy life so that we can keep our heart healthy. Thank you.
On the occasion of the World Heart Day, I wish all members of the IACTS a great year ahead. We all have a lot of work to do. India is becoming the cardiovascular disease capital of the world, and there are a number of patients who need our help. We must join the IACTS outreach program, and so that we can spread the message that cardiac surgery is safe, provides superior outcomes and better long-term results. All the very best to all the members of the IACTS, the President, Dr. Meherwal, the Secretary, Dr. Hiramat, and all members of the Executive Committee. Wish them all luck in this new endeavor. Thank you.